Let's do some anatomy. Okay. Yes. Just reviewing what we're going to talk about today, guys. Guys, April Lopez, family nurse practitioner, board certified adult geriatric acute care nurse practitioner, and wound care specialist, coming to you live today from Lopez Family and Wound Healing Clinic. We have a very exciting topic to discuss today. And as I do with every topic, it's very exciting for me to share things that are actually happening during the week. I'm not going to continue sharing for today, just for today. Don't get used to it. But I'm not going to share anything having to do with news or that poor little girl. May God rest her soul. But we remain in prayer for her. Today I want to talk about something very important. I'm just trying to see if I like how my live looks. Babe, I don't see myself. Am I live? If you can see me on the live, guys, just chime in, because I think I'm having a bad connection. I want to talk about the different stages of wound healing for you today. We're going to do it in English and in Spanish. And I've had a lot of people ask me, Ms. Lopez, do you do board certifications for wound care? So legally, you have to go through a board certifying entity. And can you double check that it is live? Because I don't see myself on my feed. Do you see me on your feed?
Yeah, I see.
You see me? I can't see myself. Okay, there I am. I see myself. I think I have a bad connection. So, okay, good. So, sorry guys. I got to make sure that I'm live. If not, I'm just talking to myself. So, thank you to everybody that's reaching out. I think you guys saw the change in my cover photo. So we've had a wound care and healthcare business consulting firm for many years, over 10 years. I have opened multiple clinics throughout the valley. In Brownsville, Harlingen, I helped UTRGV open a clinic, and I've had my own clinic. I've opened multiple businesses. Praise God, I've been an entrepreneur since 23. So I've done business consulting, but I keep it real because I'm so busy in the clinic. Praise God, I keep it real hush, and I only take certain clients. Well, now we are going to really make that available to you. If you are a person that owns a clinic, if you're a nurse practitioner, a PA, a doctor, and you're like, I don't like wound care, I don't like skin. Remember, I'm also a board certified skin specialist. So if you're a person that is saying, I want to know how I can incorporate wound care in my practice, I'm available to you. You have to call, make an appointment, shoot me a text. If you say, you know what, I want to learn how to heal wounds. I want to learn this. I'm a nurse. I want to learn it. Reach out. We'll schedule an appointment for you. I'm a practitioner. I'm primary care. I want to incorporate wound care, but I'm scared of the documentation. I don't know what Medicare insurances require for me to be in compliance with the billing. Guys, the number one thing doctors and nurse practitioners, PAs, advanced practice people, is to be in compliance. You want to be in legal compliance. You want to be in moral and ethical compliance as well. So for me, it's very important that in my practice, first of all, the reason I think why we have such great outcomes is really because we are always trying to do what's best for the patient. And in doing what's best for the patient, you're going to follow the law. First of all, you're going to follow guidelines, and you're going to do what's medically necessary for your patient to get better, right? And what is medically necessary for your patient to get better is to do a proper workup on the patient, to do proper labs, if the patient's swollen, you need to get that x-ray. If the wound is not healing for a prolonged period of time, you need to get that prior authorization for that MRI to see if there's no bone infection, osteomyelitis. There's patients walking around with wounds over 30 days. How about years? This is a valley. So we're full of diabetes, full of wounds, and people don't heal. And we believe, it's very sad that is normal. It is not normal to not heal. I'm very passionate about this. If you're not healing at your practitioner's office, seek a second opinion. If wherever you go, it's been 30 days and you're not healing, seek a third and a fourth. Be an advocate. So today I'm going to talk about the physiology of wound healing. And so if you're preparing for your board exam, we also know how to do billing. Let me go back to the business end. We know how to do billing, healthcare billing, to be in compliance, how to document according to LCDs, NDCs, NCDs, national coverage determinations, how to do prior auth. So all of that good stuff. I'm very happy to teach you. I have an amazing team. We're family. Of course, my husband, my boss, he runs the show, but he's my half. He really, really does half of everything that we do in the clinic. So, and all my team is just an extension of me. So, we have that available. We know how to do it from beginning to end. And the elephant in the room, we know how to deal with audits. We know how to deal with Medicare audits. We know how to deal with insurance audits. We know how you should be handling other types of visitors that show up, OIG, FBI. They're all over the place, guys. If you have a clinic, they're coming. If you do wound care, they're coming. This is why it's so important that you abide by the law, that we do what's medically necessary only, and that you document that you did what was medically necessary. A lot of people are guilty of doing a lot and not documenting anything. I'm a nurse practitioner. I'm a documenter. I write books. I have a patient that his notes were 100 pages long. 100. Yes, 100 pages long with multiple wounds. But he healed and healed and healed, and we're very proud of the work that we do. We can teach you how to do that. We can teach you how to deal with UPIC audits. All those audits, we do them all the time. It is, if you're in this business, you're going to get audited. Just like if you have a business, you're going to have to deal with the IRS. If you have payroll, you have to pay your 941s. You better do your reports. If you have a nonprofit, you do not a 990. You have to file your reports. We're blessed to be in the United States of America. Here, if you have a healthcare business, you're going to be audited. Be ready for it. Don't be scared about it. Do what's right. Do what's right for the patient. Follow the law. Follow Medicare guidelines and insurance guidelines, and you're going to be fine. If you don't know if you're doing that, reach out, and we're very happy to teach you how to do it. So let me talk to you today. I think you saw, I think I put it in the title, and I put, regarding wounds, if it is possible for you to have a wound that has multiple etiologies or causes and may merit different kinds of treatments throughout the treatment of the wound. Absolutely. And I hope that in the live that you're watching right now, you've been staring at my skin model, because everything that we do with wounds has to do with this baby right here. Your skin is the largest organ in your body. It is literally all of you, and it is an organ. And so it is protecting you. It is your protection. If this is disrupted, you are exposed to infection and you're not going to be well. And if you have any body part open, any area open, and I say any hole in your body, you need to treat it right away, and you should heal within 30 days. I'm going to take it a step further. You should be getting better every week. I see my wound patients every week. There's no other way but to see you weekly if you're going to heal. And every week, it's I always tell people, I have to see you. I have to see you. Don't miss appointments. My eyes already saw your wound at the beginning. And it's not just that. It's a trained 27 years of serving you guys. 27 years of serving patients that I've been touching and feeling and looking and guiding doctors as to what to do. Nurses do wound care from day one. My very first clinical patient was a wound care patient that had both legs severed, and I could smell the Pseudomonas. The wounds were blue-green. She was yelling. She was depressed. And I'll never forget my clinical instructors, Dr. Vinieto, shout out to you, and Mrs. Wilson, and she, God rest her soul. And I ran out of the room and said, I can't take care of this lady. Why not? Because she has wounds and it smells bad. I'm scared. And they will let them say, April, go in there and provide your patient with care. And I'm getting chills right now. It was like a foreshadowing of what I was going to be doing now. And now I'm a wound healer, praise God. By the grace of God, all my patients heal. I'm going to say it again. All my patients heal. If they listen, if they follow up. Some of them take longer than others because unfortunately they disrupt my wounds by either changing services, doing something that I didn't order, not showing up. They get sick. They may have underlying comorbidities like lupus or liver disease. They don't wear their compressions. But if they listen, so those will take longer. But if you listen, you're going to heal faster than the average patient. So I give God the glory for it because I pray over my patients and it's His guidance and He does the healing, but I do the work with the family and I'm going to teach you how to do it. So very important that we understand that not all wounds are the same. Not all patients are the same. Every patient has to have individualized care. Every patient needs their own labs. We need to do a review of the medications. We need to see their skin integrity, any past medical history, any comorbidities. Thank you so much for everybody that's logging in. I really appreciate it. And so reminder, if there's a topic you want me to cover, send me an inbox and I'll be happy to cover it for you. If you guys have any questions on any topic. So every patient is going to get individualized care. It is not a cookie cutter system. It is a patient individualized care. So based on the skin anatomy, guys, if you look, I've had it, you can screenshot it and rewind it. At the very top, you have your epidermis. Then you have the derma, the dermal layer. Then you have a hypodermis, subcutaneous tissue, and you're going to have adipose tissue within there, veins, arteries, nerves, sweat glands, hair. Okay. Once you see this all cut up and mushy, it's very, very different. It's not perfect like this. But if you understand the layers of skin, it's very, very important you understand anatomy and physiology. Also for the providers, you need to understand what you're cutting into if you're going to be debriding. You can't debride, by the way, if you're not an advanced practice registered nurse as a nurse practitioner, or if you're an MD, a PA, you have to be trained. I always tell people, legally, I am not an attorney. I'm not giving you legal advice, but logically, you can call your board. Everybody's scope is different. It's based on your educational level. Were you board certified in that area? Did you get education, formal education for it? And also, do you have experience in doing it? I am acute care board certified. I was trained in education with my school. I have hours for it that I can read EKGs, I can read x-rays, MRIs, I can read imaging, I can do advanced procedures. So yes, I can. A nurse practitioner that has a different scope of practice, that is just a family nurse practitioner, for example, if they have not been taught that in a formal with documentation in a program, that is out of their scope. And you can call Board of Nursing, that's straight from the Texas Board of Nursing. And so you got to be very careful that you don't practice out of your scope. So how do you get into your scope? You get board certified in it. You take a review course, you go to somebody that can train you, then you go get your board certification. You have your hours and you keep up with your CEUs so that you can be within the law to do procedures like debridement or applying plasma on the patient or advanced treatment, skin subs, anything else that you can apply to help the patient expedite healing if they've had the wound for 30 days, all in line with the LCD guidelines from Medicare, Medicaid. So, very important that we understand this. So all this information that I'm giving is not just for providers, patients. Everything I'm sharing with you is usually given in a class or in a conference. I do a yearly wound care conference for free for the reason that I don't want people to have to pay to learn. I'm going to drink. And so I do it for free. It's for providers. And then we give you all this free education. And so, but if you guys have followed our channel and our page, we stream it, or we have videos that we upload. Why do we do that? We do it so that the general public can hear medical knowledge and understand what they should be getting, what they should be, how they should be treated, because they don't know. Like I have people do marketing. That's their business. I don't know how to do that. I happen to know how to do that, but that's not my expertise. So you as the general public, you as patients deserve to be empowered to be able to make good decisions about, wait a minute, my doctor's doing this to my wound. Ms. Lopez said, that's why our program is called As a Nurse Practitioner. I'm old school with this program, right? I'm dating myself. But that's why our feeds and our videos are for Ask the Nurse Practitioner. So if you have questions, ask me. But what I'm saying is you can use this information. You don't have to be a clinician. You could say, wait a minute, Ms. Lopez said that if I don't heal in 30 days, I need a second opinion. I've been here a year. Maybe my practitioner doesn't know how to heal this wound. So I always tell patients, listen, everybody's doing their very best. Nobody's trying for you not to heal. I really believe that all practitioners are doing their very best, and they're coming at you and to you and treating you based on their knowledge, their level of expertise. Okay. So my level of expertise and my scope of practice, praise be to God, is very vast because I'm acute care board certified. I've been a hospitalist. I've rounded hospitals, LTACs, very acute patients. I manage them, multiple comorbidities in the hospital setting. I'm also an ER trauma nurse. I did that many, many years. I've been a house supervisor. I've been a professor at the university. So assistant, I've taught in the nursing program for the bachelor. So all of that stuff clearly, and I've touched and helped heal by now in 27 years, probably hundreds of thousands of people. During COVID, if you guys follow the COVID groups, you saw me a lot. I was very, very involved in the COVID groups, and we helped a lot of COVID patients survive. So I am a healer by God's grace. I like people to feel better, get better, and especially in wound care. You guys see our brochure. You can go to our page. These are our outcomes. They're all my patients. So it's very important that we understand skin. This information is for you, the general public. What is the physiology of wound healing? And why is it that some wounds can have multiple different issues within the same wound? For example, you had a car accident. I have cases where people have trauma. You had a car accident. You got hit with a bat. I had a lady that got beat up by her husband. Unfortunately, God forbid, he dragged her off. So she had all this trauma. At the beginning, it was abrasions. It was scabs. It was abrasions. It was dirt, right? After you wash that off, guess what? The wound opened. Now you have eschar, black dry blood. Now it got infected. So that's what we see here every week. Now you have original abrasions in a diabetic patient who is becoming a non-healing, that wound is becoming a non-healing diabetic ulcer. And now it's an infected non-healing diabetic ulcer. The etiology is the same, but the etiology is the cause. It happened from the abrasions of being dragged by the husband in the car. And then because she was a diabetic, her sugars are not controlled. It's very important to control them or you don't heal. And now it's got infected because it had dirt in it. So now it is an infected diabetic ulcer. And now after 30 days, it's a non-healing infected diabetic ulcer. You may have cellulitis underlying. You may also have, okay, this is a very tricky one. I'm going to throw this one out there. So you have your abrasions, now become diabetic ulcer, now become infected diabetic ulcer. Now you have cellulitis. And guess what? In the 5th week, the patient's immune system was so low from going through all of the abuse and the trauma. And now she developed shingles in the wound. That is one of the top undiagnosed issues in wounds. They come to me and I'm looking at the wound. And since the very first time I lay eyes on the wound, I'm like, this looks different. Okay, it's very hard. People don't like to deal with dermatology. I deal with skin too, with acne. We're going to start doing our chemical peels again. I help patients get cleared from their face. I had cystic acne. I cleared it. We have a lot of pictures. So I'm like, this is not normal. Once we took care of the infection, once the swelling started going down, once we got rid of all the dirt and rocks she had within the wound, there they were, the blisters from shingles, a lot of different pain, a lot of different oozing. Now guess what we have to do? We gotta give her an antiviral, Famvir or Ciclovir, depending on the patient. Now guess what we have to do? Now we have to draw labs on the patient, check the kidney functions, check the liver function. Ms. Lopez, you're very exaggerated. Why do you have to do all that for your patient? I have to do all that for my patient because I'm an excellent provider. Excellence above all things. I am not going to jeopardize my patient in having a potential worsening infection, a sepsis, the infection to go to the blood or lose a limb or really have to be hospitalized because I am negligent and I am not going to check liver and kidney function before I treat with aggressive antibiotics. Every medication can have you have issues with liver or kidney. So the provider should take a baseline also to look for what? A white blood cell count. Why do I need to know this as a layperson? Why do I need to know this as a non-medical provider? Well, maybe you need to know this because nobody tells you this, what's expected of a provider. And you need to say, pardon, may I please have some baseline labs so I can look at the white blood cell count and see if I have an infection that's worsening or something that either needs to be hospitalized or if I need to go to we need to track it. Like, do I need to go to the hospital or can I just stay out here? Sometimes you have elevated white count and guess what? That's leukocytosis. You need to get to the hospital because there's something going on that's worse than just outpatient. So in my case, we've kept a lot of patients out of the hospital. We did it throughout COVID. We didn't want you to go because we knew that if you went to a hospital, you probably died. So I still practice very aggressively, but that's just me. Those kind of patients, I see them daily. I'm very aggressive. I have a lot of advanced treatments that I can do. I can do IV therapy if I want it. I can do IM shots. So that's a different kind of practitioner. For the general person, it's very important that you're like, okay, are my white blood cells okay? Do I need labs? How's my liver and kidney? Because now you're going to give me 2 antibiotics. Am I okay to take them? And then guess what? If you're going to be on antibiotics for more than a week, you need to follow a lab because now you are immunocompromised. Everybody with a wound is immunocompromised. What that means is that your immune system's already low because you have an open hole in your body. So therefore, you need to be careful with that because your system's already low. We don't know if you're not hydrating. Your kidneys could go into issues, or even if you see a change in GFR, which is a glomerular filtration rate, you have to address that. So very important. One of the things that I saw a lot when I would round with my acute care patients in the hospital was primary, and then I did wound care as well. I managed my own wounds in there, is practitioners that would start patients on IV antibiotics and their kidneys were perfectly fine and they never flushed. They were dry, a little bit dehydrated, and they never gave them IV therapy to keep the kidneys going. And guess what? The patients were going to acute renal failure. It is very important. Every case is different, but those of you that do acute care and hospitalist work understand that if you don't take care of those kidneys, you could very quickly be in acute kidney failure, and we don't want that for our patients. Those are the kind of things that why you need to know. I'm sharing with you information that you can use to potentially save your own life or your family's life. So save our videos, share and like, and subscribe to our YouTube channel. So how do you heal? So very important. The wound is not going to have the same status every week. Maybe sometimes it does if you're blessed and lucky, but a lot of times things change. So you have to see, you know what, let's change it to this week. You know what, it's working great. Let's continue with that. If you're doing the good old Silvadene, doctors and nurses and nurse practitioners, you love that Silvadene. Silvadene is for burns. If you put too much Silvadene, it can be toxic. Silver is not for everything, and it's not a cure-all, fix-all. So if you've had Silvadene on that wound for 14 days, it's not getting better, it's just getting worse, get a second opinion. If you're not getting in 30 days, I have patients that have been using Silvadene for years. They're still using, and they're not being referred. You can be your own patient self-advocate and refer yourself. So, how do wounds heal? We have the first phase of wound healing. That's a vascular phase. That's whenever you get the injury, you get the hemostasis, you get the immediate response, and then you have the bleeding. You have the vasoconstriction. Let's go back to remembering all that. And then you're going to have platelet formation, okay? You're going to make a clot. You're going to make a nice fibrin clot. And that's the first part of the wound. When you get that, go see your wound specialist. Don't wait till you've had it for a month. That's all festering and literally falling off your leg or your arm or the skin. No, go right away. So we can do aggressive wound care and help you heal so you don't have any complications. Next phase is inflammatory phase. This is where patients get real scared. If they come to me in the inflammatory phase and they're like, Lopez, my whole leg's infected. It's red, it's hot, it's swollen. Red hot swollen legs or red hot swollen area over a wound. Initially, if you're in the inflammatory phase, it is not necessarily an infection. It is a normal response to inflammation, the attraction and activation of cells. You're going to have platelets, you're going to have monocytes, you're going to have the cleanup crew, which are your phagocytes, and you're going to have macrophages and all that good stuff. Let's go back to our basic healing and our basic cellular foundation. And so you're going to see that. That's within days 4 to 6. So if you're constantly in the inflammatory phase, you're not healing. So you need to go see somebody else. After inflammatory, you have migratory phase. What's happening in migration of cells? You have fibroblasts, ongoing phagocytosis. The macrophages are eating the bad players. And then after that, you have the proliferative phase. In the proliferative phase, this is where we want to get you to. I have patients that are stuck in the inflammatory phase for 6 years. 6 years. Even 35 days is too much. You can't be stuck in the inflammatory phase forever. We need to get you to the migratory and to the proliferative. And at the proliferative is my favorite, where I see all that nice granulation tissue. Angiogenesis means new vessels, epithelialization, and it's proliferative days, usually 6 to 14. And then after we do that, God made us so awesome, we make new vessels. Then you have the maturation. This is where patients sometimes get annoyed. Maturation of a wound after you've had a wound can take up to 2 years. Yes, 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 up to 2 years. That's why I tell patients, after you've had a wound, it only comes back at 80% textile, 10 textile strength. That's not the right word. Tensile strength. So what does that mean? The thickness of your skin. Only 80%. That strength is never going to be 100%. That's why if you have a scar, It will always hurt, yes. Don't believe people who say, oh, you're gonna be fine. It's not gonna hurt that much. It's literally just you'll be fine in 2 weeks. No, it's gonna hurt the rest of your life. I tell people, my scars that I have always bother me. When it gets cold, they get dry, they hurt me. Sometimes they bleed. I have to put Vaseline on them. I have to take care of them. I can't put too much soap over that area because it'll irritate it. So sorry guys, I have to be perfectly honest. People are telling you you're never going to feel it. They're lying. So unfortunately you have nerves that have been interrupted, disrupted. Tensile strength is the word. Yeah. So then, if it's a very deep wound, you had nerve damage all the way in. So it's never going to come back the way it used to be. But I tell people, these are my battle scars. My scars, my wrinkles, my sunspots, they're my battle scars, right? So understand that a wound's going to take that long. That's why whenever you finish healing, sometimes patients' wounds reopen. It's a new wound now, but it's because the maturation phase can continue on for 2 years. So I went on too long in the English version. I am going to say it real quickly in Spanish. But it's very important that you understand that you're not going to always throw Silvadene, wet to dry, betadine, whatever the doctors are ordering now that is not appropriate. It is old school, old evidence-based. There's so much good stuff that we're using. I like to use a lot of good powders, oldie powders that are cheap, that heal patients. I like to use advanced wound care. I do PRP here in the clinic. We draw your blood. We make this awesome gel. We apply it to your wound. It's your own cells, and it'll heal your wound. That has a national coverage determination. That means it's covered all over the country, and it does not require prior auth. We still run insurance anyway to be safe, but then we also have advanced skin subs. And there's been a lot of talk where they work amazingly. That's placental. Then we also have good old powders, depending on the insurance. Whatever your insurance covers is what we do. Whatever is medically necessary for you is what your practitioner should be doing while documenting appropriately and elevating the business of wound care by doing the right thing for the patients. Patient advocacy and excellence and good moral and ethical values in making decisions. But do not let them do the same wet to dry treatment that's not healing your wounds forever, because your wounds may not need that every week, the same thing. It may need something different. And watch out for these shingles that can grow within the wound. And that's the spiel. That's the life for today in English. I'm going to switch over to Spanish. Familia, Abril Lopez, enfermera de práctica avanzada y especialista de heridas. Estamos en vivo desde la clínica Lopez. Estamos platicando de la piel y las diferentes etapas de la sanación de las heridas. Y básicamente algo muy importante, el tema que estaba tocando yo ahorita, es que su herida no siempre va a necesitar el mismo tratamiento. Nosotros sabemos que aquí en el Valle, desafortunadamente, tenemos pacientes que tienen las heridas por años y por alguna razón aquí se ha aceptado que los pacientes nunca se sanen. Eso para la gente es normal. Eso no es normal, familia. Si usted está yendo a su médico y ya lleva más de 30 días con una herida, de acuerdo a la documentación clínica y todos los libros y nuestros estudios, esa herida es una herida que no se está sanando, necesita una referencia para alguien que sepa sanársela. Si usted como paciente no me puede mandar con un especialista, por favor. Nosotros en nuestra clínica no necesitamos referencias porque soy enfermera de práctica avanzada general también. Estoy certificada en heridas, en piel, y estoy certificada en clínica familiar general, y estoy también certificada en cuidados agudos, hospitalista y geriatra. Entonces, aquí no necesitamos referencia. Quiero que me vea un especialista porque mi herida lleva más de 30 días, no se está sanando. Abril López dijo, yo estoy dando información a la comunidad. ¿Por qué estoy dando información a la comunidad? Porque quiero que usted esté empoderado, que usted tenga su información, esté educado y diga, espérame, como decimos en el pueblo, espérame tantito, espérame un momento. Esto se me hace que no debe de ser así, yo me debo de sanar. Eso, miren familia, nada más en las heridas, es el único tratamiento y en la única área clínica que yo he notado que se acepta mucho que la gente no se sane, ¿ok? Si tú vas con un médico y te están checando la presión y te están dando medicina para la presión y tu presión está en 200/100, le vas a decir, doctor, no me está curando, no me estoy acomodando, no me está nivelando. Es lo mismo con las heridas. Si usted tiene una herida 30 días o más, es una herida que no se sana. Necesita una referencia para otro doctor, otro especialista. No se trata, familia, legalmente, moralmente, éticamente, no se trata de que yo le esté viendo cada semana y usted no se cure. De eso no se trata. Si lo están viendo cada semana, se trata de que se mejore, de que se le controle la diabetes, se le controle la presión, se le controle la depresión, que ayuden a bajar peso y que se sane la herida. Soy también especialista de piel, tengo muchos pacientes con acné, hacemos chemical peels, que son unos líquidos que ponemos para rejuvenecer también, pero también para el acné o para problemas de la piel. Entonces, te debes de estar viendo mejor, no peor o igual. No se trata de cobrar, se trata de sanar. Eso es muy, muy bueno. Entonces, hay diferentes niveles. También hacemos consultas de negocios, les ayudamos a los doctores a aprender qué poner, qué aplicar, cómo sanar heridas. Entonces, hay varios niveles de sanación. Mucha gente me dice, esta es la piel y estos son los diferentes niveles de la anatomía de la piel. Una vez que entendemos esto, entendemos que las heridas se sanan de afuera para adentro y de abajo para arriba. Muy importante. Entonces, sus heridas se deben de estar achicando en lo largo, en lo grueso y en lo hondo. Sí, y pregúntenles, familia, ¿cuánto midió mi herida, doctor? Si el doctor ni siquiera le está midiendo, pues no quiere saber cuánto mide, porque mide lo mismo por los 10 años que lo estás viendo. Eso no es correcto. Hay que medir. Así como hay que checarme, doctor, traigo la azúcar en 300, eso no se acepta. Necesitamos más medicinas, cambiar de dieta, algo. Entonces, ¿cuáles son las etapas de sanación de acuerdo a los estudios clínicos? Número 1 se llama vascular, es cuando te cortas, hemostasis, que van las plaquetas, van las células y van a llegar a ser el coágulo para que dejes de sangrar. La que sigue, la fase que sigue, desafortunadamente es la fase donde la mayoría de los pacientes se quedan atorados, estancados, y se llama inflamatoria. La fase inflamatoria, donde te vas a inflamar, se va a poner roja, caliente la piel, y eso es solamente de día 4 a 6. Si tú llevas 30 días, 2 meses, 5 meses con la piel, donde está la herida roja, inflamada, caliente, puede ser una infección, puede ser otra cosa, pero no se debe de quedar ahí. Ahí es donde hay plaquetas, hay monocytes, no sé si son monocitos, macrophages, que son las células que se comen a las células malas, a las bacterias, a la piel muerta. Entonces todo eso va a migrar para allá. Luego sigue la fase proliferativa. ¿Qué quiere decir? Ya estás viendo granulación. ¿Qué es granulación? Unas bolitas rojas que se ven en la piel, que se está sanando. Estos casos que ustedes ven aquí son de nosotros. Pueden tomarle foto en zoom in y enfocarse, porque no los puedo poner porque me regaña Facebook. Pero ustedes pueden tomarle foto, enfocarse para que vean los casos de nosotros, o ir a nuestras páginas de web o en nuestra página de Facebook para que vean todos los videos y las fotos de los que se han sanado. Ahí se ve mucha granulación, que es el área proliferativa. También es angiogénesis, que es cuando creas nuevas arterias, nuevas venas, y epitelialización, como parangaricutirimícuaro, esa sí me la sé, pero la epitelialización, esa ya me atoro un poquito. Otorrinolaringólogo también me lo sé, pero porque ya lo platiqué. Bueno, seguimos con los trabalenguas. Entonces, ¿qué es epitelialización? Que ya se va creciendo básicamente la carne, se va creciendo la piel, se va sanando la herida. Lo muy importante que a mí me gusta mucho tocar es la fase de maduración. La fase de maduración se puede tardar hasta 2 años, lo cual quiere decir, familia, que cuando un doctor o un practicante de práctica avanzada le dice, no te preocupes, tú en 1 semana ya vas a estar bien, se te va a cerrar la herida, no vas a batallar. Mentiras. Una herida se toma tiempo para sanar si te están curando bien, pero cada semana debemos de ver mejoría. Te tienen que dar el resultado de la medida de la herida, lo largo, lo grueso y lo hondo, y escríbelo. Y cada semana se debe de ver o mejoría en la piel alrededor, o menos inflamación, menos dolor, o una herida más pequeña. Yo tengo pacientes que la herida sigue el mismo tamaño, pero ya la pierna no es inflamada, ya se está viendo carnita nueva, ya le duele menos. Entonces, esa también es mejoría. Y se puede tardar 2 años, entonces, lo cual quiere decir que si yo tengo una herida, se puede tardar más de 1 año en que ya se madure bien, se amacice la carne, como decimos. Desafortunadamente, lo grueso y lo fuerte de la piel nunca regresa al 100%, se va a quedar en un 80% solamente, pero bueno, el 80% es mejor que tener el hoyo abierto de carne que se te está viendo. No debes de traer eso por más de 30 días, y si no se están sanando, pidan una segunda opinión. Entonces, muy importante saber otra cosa, la herida no siempre va a necesitar la misma curación. esta semana necesita a lo mejor una curación, ya la próxima semana lo veo y digo, bueno, espéreme, hay mucho líquido, hay que cambiarle un polvo, o sabe que está muy seca, quítele el polvo, vamos a ponerle otra cosa. Y a la gente le gustan mucho los ungüentos, las cremitas. No puedes ponerle una cremita a una herida mojada. Si su doctor le está poniendo cremita a una herida mojada y le está saliendo más agua, y óigame, y luego las medidas siguen igual o se está haciendo más grande, por favor necesita una segunda opinión. No necesita permiso. Usted no trabaja para nosotros, nosotros trabajamos para usted, nosotros le servimos a usted. Usted puede buscar una segunda opinión. Ahora, he tenido casos, un caso muy importante. Una paciente tuvo un traumatólogo, fue a ver traumatólogo, se la arrastraron en un carro, se le abrieron, tuvo muchas raspadas y con tierra y todo. Bueno, ahí es un tipo de herida. Una semana después, la señora es diabética, la chava es diabética, se le empezó a infectar la herida, se le empezó a inflamar roja, ya traes una infección de pierna, una infección de piel, ya necesita antibiótico. Ya se pasaron los 30 días, no se sanó, ya es una úlcera diabética que no está sanando y ya trae otro problema, se cambia la curación basado en la herida y estamos viendo, traes controlada el azúcar. O sea, es todo un rompecabezas que si la persona no sabe lo que está haciendo, ahí es donde está el problema, porque en el valle no se sana la gente. No se trata de tenerlo en la oficina cada semana, se trata de sanar. Entonces, ya al último, esta muchacha de tanto estrés que tuvo, se le bajó el sistema inmunológico, porque si tú tienes una herida en el cuerpo, tienes el sistema inmunológico bajo. Hay riesgo de que se te vaya la infección a la sangre y eso es muy peligroso, puede ser mortal. Pues no le salieron los chingos en la herida, que son la varicela, la viruela. Cuando a ti te ha dado la viruela, es un herpes, básicamente, herpes zóster. Y básicamente eso se mantiene en tu cuerpo dormido y cuando tienes un problema inmunológico o un estrés muy grande, puede salir y son los globitos que son los blisters que le llamamos de herpes zoster. Entonces, bien difícil porque se le hicieron muchas ampollitas adentro de la herida, la pobre. Y ya después le dije, ¿sabes qué? Vamos a barrerte con un huevo, con todo respeto, no se crean. Pero dije, oye, mija, ¿ya qué te hacemos? Entonces, ahí le tienes que cambiar a ponerle una crema ciclovir y yo les doy crema y algo tomado. Pero ahí necesitamos ya sacarte sangre, porque ahí, como dice Cantinflas, cuidado, chato, porque se te puede secar el riñón o se te puede dañar el hígado. Entonces, te sacamos sangre, te empezamos este medicamento, te volvemos a checar después de 1 o 2 semanas para asegurar que lo toleraste bien y luego vamos a tener que regresar a un antibiótico ya que le tratemos los chingos porque todavía trae infección. Entonces, bien importante que tengamos en mente tantas cosas que les acabo de compartir. Primeramente, que no necesita quedarse donde no la están sanando. Segundamente, que la misma herida puede necesitar diferentes tratamientos en diferentes etapas de la herida. Y terceramente, que usted pida medidas, que pida cómo va la herida. La única forma de ver es si se siente mejor, si se está haciendo más chiquita, si huele menos, si se está sanando. Y le voy a decir una cosa, si usted se ve la pierna y no se está sanando, no necesita que el doctor le diga que no se está sanando. Usted se está viendo. ¿Sabe qué? No me estoy sanando. Diga, busque una segunda opinión. ¿Por qué razón, si no nos gustan unos tacos, no volvemos a ir a ese restaurante? Pero si no nos gusta el médico, le seguimos yendo para que nos maltraten. De eso no se trata. Nosotros estamos para servirles, para sanarlos, para ayudarles, para alentarnos. Y es todo de lo que voy a hablar hoy. Es un placer verlos y nos vemos la próxima semana.